Let's talk about sort of the latest policies, whether we're talking about the bill that just passed, which I refuse to call it beautiful because it's going to result in so much suffering and so many people are going to be less healthy as a result of these quote unquote priorities. But you've written a lot about the impact this bill is going to have on public health. Can you talk about that? I mean, not just Medicaid and SNAP, but also other areas?
Yeah, yeah. So, the bill essentially, what the big ugly bill, that came out is really, it's a public health disaster. I think those are the terms that I used in one of the things that I wrote, because we when we started talking, I was kind of talking about health disparities in the country, right? And the whole goal with the MAHA movement with the Trump administration, on his inaugural address, he said he was going to end the chronic disease crisis. That those were his words. And so, if you want to end the chronic disease crisis, as someone who's been, studying this for the last 15 years, you have to look at who's most impacted by chronic disease. And that's low income people in this country by far. And so, what are the strategies, the public health strategies we have to really impact those low income people and really help them? The two biggest ones are Medicaid and SNAP. And Medicaid really provides health care because two of the biggest determinants of health are access to health care and access to food. And so, Medicaid helps to get everybody access to health care so that, what happens when you don't have access to health care is you will just kind of like wait till longer, right? You're not going to go to your checkups. You're going to wait till there's an emergency and you're going to show up at the emergency room and they're still going to treat you, by the way. You're still going to get that health care. And those costs are going to be kind of passed on to taxpayers through different ways, increased hospital costs, also uncompensated care that we all pay into as taxpayers. And so that's a big one, just stripping healthcare from people. Billions of dollars are being taken from SNAP, which is the Supplemental Nutrition Assistance Program. It's the largest cut to SNAP, in addition to the largest cut to Medicaid in history. And so, SNAP is really, it helps to decrease food insecurity in this country, directly helps to decrease food insecurity. So when you take, hundreds of billions of dollars away, it's going to increase food insecurity, which is one of the biggest determinants of poor health in our country.